I've pretty much run the gamut of positions here at Premier Health. When I first started at the lowest level, I was a resident and I was moonlighting. And then subsequently, I've been a full-time physician, lead physician, and then most recently, assistant medical director. I think one of the best things about the culture here is that there's a focus on good patient care. There's a focus on supporting the physicians decision making. And I really think that's one of the most important things, when you're a young physician and you're looking to enter a clinical practice, is how much support do you, truly get. One of the things I really enjoy about working at Premier Health affiliated clinics is that you do have a lot of ancillary staff support. Premier Health, they've really got it set up well. Each clinic has a front desk staff that handles all of the patient sign-ins, insurance. We have nursing that does your blood draws, that does your shots. We have an x-ray tech at every clinic that handles your x-rays. So literally all you are doing is seeing the patients, taking care of them, in the most direct way possible. You have some urgent cares that are physician-owned, like Premier Health, and you have a number that are not. They're either owned by corporations or entrepreneurs that don't have a medical background. My personal experiences with Premier Health, but again, I have friends of mine, colleagues that work at others, and you can really tell there's a big difference. Anytime that we have a provider meetings, our physician owners are there, and they're providing their input, and you can tell that a lot of the decisions are made at their level with their input. I think as a resident, you're really looking for a couple things. You're looking obviously to make a little extra cash, but I think also, you're looking to expand some areas of your education that you may not have gotten in residency. For me, especially, those were to be able to get a little bit better with my outpatient medicine and to get better with my procedures as well. And I think it was a really great experience working here when I was a resident because, like I said, not only do I get a chance to make a little extra money, I learned a lot of things that my residency didn't go over. The flexibility that Premier Health offers is great, especially if you are moonlighting or PRN. For example, as a resident, there would be some months where I just couldn't work at all, and the schedulers took that into account. And there are some months I could work 6 to 8 weekend shifts, and they also took that into account to try and give me as many shifts as I wanted. Never did I ever have a problem with the shifts they gave me, and on the occasions that I did, if my schedule were to change later, I never had a problem just calling, explaining the issue, and they were always able to find a replacement. So again, it never had to sacrifice anything that I had to do in residency. I think urgent care, when you're talking purely from getting extra experience to supplement what you're learning as a resident, I think it's a great setting. The majority of the stuff you'll see in the clinic is stuff that you can handle. On the rare occasion that's something that's a little bit beyond your expertise, there are other physicians working at other Premier Health clinics that you can pick up the phone. Or worst case scenario, if it's a patient that you have to transfer to the emergency room, you have that capability. Not all urgent cares are the same. Some provide you a lot more training than others. Some provide you with a bigger support staff. There's some urgent cares that, because they're standalone operations, if you're working that day, again, and you come up with something that you're not sure about, the medical director may not be available. There may not be anyone else for you to call. Whereas with Premier Health, we have other locations where other providers are working, and you're always welcome to get their opinion. Remember, if you're a resident, that's going to be your main priority. You don't want to do anything that sacrifices your standing with your residency. That means that all moonlighting, needs to work around that. And Premier Health has a large variety of locations. We have a large variety of hours and clinics, and we'll work with you around your schedule. We're not going to come to you one month that you can't moonlight and say, well, doctor, for you to stay with us, you're going to have to find 2 days this week to moonlight. We're not going to do that to you. We're going to know that your priority is with your residency to do a good job with that first.